Are you a mom or hoping to be one? In just 3 months, new rules signed by Health and Human Services Secretary Robert F. Kennedy Jr. have quietly started pulling apart the safety net that protects pregnant people, newborns, and anyone who ever plans to become a parent. Here's a breakdown of the changes he made to the services that could save your or your child's life. First, the Pregnancy Risk Assessment Monitoring System, or PRAMS, was shut down. PRAMS is the national database that tracks why pregnancies sometimes end in tragedy. They monitored things like hemorrhage, high blood pressure, and suicide in the year after birth. When those 17 epidemiologists were laid off on April 1st, state health departments lost their dashboard for spotting deadly trends. Then, the CDC's Birth Defects Center was eliminated. That office logs conditions such as spina bifida, cleft palate, and Down syndrome. What they do then is alert hospitals and researchers so babies can get early surgery, therapy, or family support. Without those alerts, parents may not learn about crucial treatments or about state assistance programs until it's too late. Over at NIH, dozens of maternal health studies were frozen overnight, including a New York trial testing a faster way to stop postpartum hemorrhage, the #1 cause of birth-related death worldwide. Every month of delay in a trial like that literally costs lives. The FDA also lost more than 700 inspectors who check infant formula plants and hunt for lead in baby food. That means the next bacterial outbreak or metal shavings recall could reach your grocery cart before anyone even notices. Meanwhile, Kennedy ordered the CDC to halt its flu shot advertising and rewrite all vaccine and messaging around informed consent. That sounds good, but doctors say it leaves pregnant patients confused about routine shots like Tdap. That's the combination vaccine for tetanus, diphtheria, and whooping cough. It's a disease that can kill newborns before they're old enough for their own shots. We all should have as much information as possible, but the policy as written scares people off of proven and safe vaccines that save children's lives. And this is only round one. Kennedy has promised a top-to-bottom review of every childhood and prenatal vaccine, meaning that Tdap label and brand new RSV shots that prevent winter lung infections could lose the safe in pregnancy stamp parents rely on. Right now, they are pushing what they call a Bill of Rights for public health services, but that's just the name. One thing it really does is push WIC breastfeeding counseling onto private insurance networks. WIC counselors are usually moms from your own community who teach latching, pump use, and safe storage hacks for free. Add insurance copays, and many low-income families will simply skip that help, leading to more formula costs and more infections in babies. At the same time, an HHS footprint audit labels dozens of rural, VA-adjacent hospitals as underused. Maybe so, but they're used by people who need them. History shows audits like that end with maternity ward closures, forcing expectant mothers to drive an extra 30, 50, or even 70 miles. Studies link those longer drives to sharp increase in emergency C-sections and maternal deaths. Environmental health teams that test fish for mercury and tap water for forever chemicals like PFASs were also laid off. For pregnant people, that means fewer warnings about toxins linked to learning differences and disabilities, as well as low birth weight. Former CDC Director Tom Frieden calls the layoffs a patchwork that leaves Americans less safe because outbreaks from syphilis to listeria get spotted only when specialists crunch nationwide data. With those specialists gone, we're effectively flying blind. So what do we do? Call Congress. Tell your representatives to restore PRAMS, the Birth Defect Center, and rural health funds before the 2026 budget is final. Ask your OBGYN whether their hospital depends on CDC labs or WIC lactation grants. If they do, they need to speak up too. Share this information with anyone who might become pregnant. Most people don't know these programs exist until they desperately need them, and by then they're gone. Thanks so much for watching. I know a lot of these things are scary. The fact is that resistance to changes that could hurt you and your families begins with knowing the policy and speaking up about it. If you are interested in these kinds of policy dives, for instance, the impacts on veterans of the Trump administration, you can find more on my playlists. Please do follow, like, subscribe, and share. I'm trying to get the word out. Please share your stories and advice in the comments. Your experiences and expertise could save someone else's life or their child's. Thanks so much for watching, and have a great day.